Hi, my name is Kelly Cascario, and I'm going to do my presentation on cardiac glycosides. And as the name implies, these are medications that work on the cardiovascular system. The pharmacological class is cardiac glycosides, also known as digitalis glycosides. And in the pregnancy category is pregnancy category C. So the cardiac glycosides were originally derived from the foxglove digitalis plants. The common medications in this group are digoxin, and deslanoside. Cardiac glycosides in pregnancy category C, meaning that animal trials have shown problems to the fetus, but there are no comparable human studies that have been done to show this. And sometimes it's important to give it to these patients, and the benefits of receiving the medication outweigh the risk, so it will be given. The therapeutic class there's two of them. There's cardiotonic inotropic agent or antiarrhythmic agent. So cardiotonic agents are also called inotropic agents because they work on the contraction strength of the heart. Cardiac glycosides are known as the classic cardiotonic agent, and the newer cardiotonic agents are the phosphodiesterase inhibitors. Arrhythmias are seen on electrocardiograms and due to changes in the automaticity and conduction in the heart cells. Antiarrhythmic medications alter either the automaticity, the conduction, or both, and try to correct the arrhythmia. There are 5 classes of antiarrhythmic agents, and they're just called class 1 through class 4, and then the last class is called others, and that's the group that the cardiac glycosides fall under. So cardiac glycosides are given for 2 things. They treat patients in heart failure, and they can also treat patients in atrial arrhythmias. Heart failure is a complex syndrome resulting from any functional or structural disorder of the heart that results in or increases the risk of developing manifestations of low cardiac output and or pulmonary or systemic congestion. So the pathophysiology of heart failure: the heart is responsible for pumping the nutrient-rich blood to the rest of the body. The efficiency of the heart as a pump is determined by the amount of blood that it ejects each minute. When the heart does not pump correctly, it is known as heart failure, and it results in not enough blood being pumped to the rest of the body to meet the metabolic needs of the body. The heart is amazingly adaptable, and it will increase the output at rest and decrease the output with activity. The ability of the heart to increase its output during increased activity is called the cardiac reserve. In heart failure, patients will use this cardiac reserve even at rest, so then when they become active, they no longer have the cardiac reserve to fall back on, and that's where they show signs and symptoms of heart failure, such as the shortness of breath and weakness and fatigue. There's several types of heart failure: systolic, diastolic, left versus right, and high output and low output. So systolic failure is a problem with the myocardial contractility. It causes a decrease in the ejection fraction. Diastolic failure is a failure of the left pump to fill completely, and that also results in decreased cardiac output. And that's because the ventricle is not filling all the way, so when it contracts, it doesn't have that atrial, it doesn't end up with a kick, and it doesn't have as much blood to pump out. Left-sided failure is a problem with the left ventricle, and when the left ventricle fails, the blood backs up before it, which would be the lungs, so that's when you get the pulmonary congestion and the difficulty breathing. And then you're not pumping enough blood to meet the metabolic needs of the rest of the body, so the rest of the body is not getting enough of the nutrient-rich oxygen. In right-sided failure, it backs up before the right side of the heart, which would be the rest of the body, so that's when you see like the pedal edema, and then it's not getting enough blood pumped forward, which would be to the lungs, to get oxygenated so it can be sent to the rest of the body. High output failure means that the heart may be pumping out more blood than normal, but the problem with this is it's pumping faster and harder, requiring an increase in metabolic needs, and this increase in metabolic needs the body will not be able to keep up with. The heart won't be able to keep up with. And then the low output failure is caused by an impaired pumping ability of the heart. So there's 3 types of atrial arrhythmias that cardiac glycosides work on: atrial flutter, atrial fibrillation, and paroxysmal atrial tachycardia. Atrial flutter is a type of tachydysrhythmia. On ECG, it's distinguishable by its characteristic sawtooth type F waves, which is your atria contracting. They originate from an ectopic foci in the right atrium, and atrial flutter is caused by an atrial rate that's faster or higher than the ventricular rate. That's why you see more F waves for every QRS wave. Atrial fibrillation, or AFib, is caused by a total disorganization of atrial electrical activity due to multiple ectopic foci, resulting in the loss of effective atrial contraction. And on the ECG, this is recognized by the QRS that they say is irregularly irregular. So the QRS never marches out. It's always a different distance apart. And then lastly, the paroxysmal atrial tachycardia is an arrhythmia that originates in an ectopic foci of the atria due to a reentrant phenomenon caused by a one-way block in the atria. On the ECG, it is seen as a rapid rate of the QRS, and often you won't see the P wave on the ECG because it is hidden within the QRS. So how do cardiac glycosides work? Calcium is released from the sarcoplasmic reticulum of cardiac muscle during an action potential. This calcium, in turn, diffuses into the myofibril and catalyzes the chemical reactions that promote the sliding action of the actin and myosin filaments along one another to produce muscle shortening. The resulting muscle shortening is the cardiac muscle contraction. During the action potential, calcium also rushes through the calcium channels in the T-tubules and the myocardial cell membranes. And this increase in calcium that rushes through causes strengthening of the contraction to increase. So therefore, it increases the intracellular calcium and allows more calcium to enter the myocardial cells. Therapeutic goals, as mentioned earlier, heart failure is a result of the heart to not pump enough blood to the rest of the body. The goal of cardiac glycoside is to increase the pumping efficacy of the heart. By increasing the myocardial contraction, the heart will be a more effective pump. The increased contraction then leads to an increased cardiac output. With the increased output being increased, more blood is going to be pumped to the rest of the body. With the more blood going to the rest of the body, the kidneys are going to get better perfusion. As the kidneys get more perfused, you're going to have your increased urine output. You're going to have a decrease in overall blood volume and a decrease in renin release, which then leads to a decreased activation of the renin-angiotensin-aldosterone system. Cardiac glycosides also work in slowing the heart rate by slowing the cellular repolarization, and they slow the conduction speed through the AV node. The slowing of the heart will help to decrease the metabolic needs, which also puts less demand on the heart. Adverse effects of cardiac glycosides include headache, weakness, drowsiness, vision changes, GI upset, anorexia, and the big thing to watch for is the digoxin toxicity. Digoxin toxicity is digoxin has a narrow therapeutic range, so patients can easily reach a toxic level with digoxin. Part of this can be because they're not absorbing the medication correctly. They can be overdosed, whether intentionally or accidentally. It just depends. The symptoms you're going to look for are anorexia, nausea, vomiting, malaise, depression, irregular heart rhythms, including heart blocks, atrial arrhythmias, and ventricular tachycardia. This is a life-threatening illness, and it should be treated immediately with the antidote, which is digoxin immune therapy. Contraindications include allergy, ventricular tachycardia, ventricular fibrillation, heart block, sick sinus syndrome, idiopathic hypertrophic subaortic stenosis, acute myocardial infarction, renal insufficiency, and electrolyte abnormalities. It should also be used cautiously in patients that are pregnant or lactating, and in older patients and pediatric patients. Nursing management for cardiac glycosides is going to be similar to nursing management from other medications as well. You're going to do a focused physical exam. You want to know what the patient's baseline is. You need to know this so that you know if they're having adverse effects, you'll know the change. If the medication is working, you can see the improvement. If they're having digoxin toxicity, you'll notice that as well. Pay particular attention to the cardiovascular system, the neurologic system, respiratory system, integumentary system, and the gastrointestinal system, because that's where you're going to see these changes, whether positive or negative. It's also important to monitor lab tests when giving this medication. You want to check potassium levels to make sure they're not becoming hypokalemic and can go into an arrhythmia. You want to check their calcium levels. You want to check the other electrolytes. And you also want to check their renal function test. You want to make sure that the kidneys, now that they're getting perfused, are having an improvement in their function. It's also important before giving this medication to monitor the apical pulse for 1 full minute. If the patient is bradycardic, you could cause worse problems for them by giving this. So if you take it in below 60 or above 100, make sure that you notify the physician and see if he still wants you to proceed with giving the medications. As with any other medications, it's important to perform the medication rights. Is it the right patient? Is it the right dose? Is it the right time? Is it the right medication? And is it the right route? Also, do the right documentation, and then any other rights that are required by your hospital. Patient teaching is a very critical part of the nurse's job. The patient should know what they are taking, why they are taking it, and what it will do for them. They need to know not to skip any doses or not to double up on any doses. They also need to know to take their pulse and keep a record of it before they take the medication each day. And they need to monitor their weight closely. They need to take their weight at the same time every day in the same amount of clothing. Patients need to learn what adverse effects to watch for, including signs and symptoms of toxicity. Lastly, teach the patient to tell all healthcare providers that they come in contact with that they are on this medication. Avoid any over-the-counter medication, and schedule regular follow-ups with their doctor. Cultural considerations include perceived illness and causes, understanding the disease process, communication of symptoms, communication with the healthcare provider, medication and treatment compliance. As with any medication, it's important to take culture into consideration when giving cardiac glycosides. As cardiac glycosides typically do not act differently on different cultures and ethnicities, there's not that concern, but the concern is that the patients are understanding what they're being taught, and making sure that they understand these things and can communicate with the provider will help to create a more effective medication compliance. So the doctor knows that they're going to be able to tell them if they are having problems with them, so they know if they need to adjust the dose or take them off. So my first article was based on best practice. Cardiac glycosides have been around for 2,000 years. They were used by ancient Egyptians and the Romans. They called it a natural medicine because it came from plants. With each patient, for best practice, you want to make sure you're finding the right dose. Due to illness, medication, other medications, age, different patients will require different dosages. Too little, obviously, you're not going to get the desired effect, and too much, you can see signs of toxicity and have other problems. For this reason, it's important to start with a low dose and slowly increase until the signs of heart failure have improved to where the doctor feels comfortable with it. Or if you go up too high and start to see signs, adverse effects or toxicity, and the patient dose needs to be brought back down. When taking cardiac glycosides, patients also need to learn to avoid St. John's wort and metamucil, as they will decrease the absorption of digoxin. Aloe will increase the potassium excretion and also increase the patient's risk for toxicity. And Mawang and ephedra also increase the patient's risk of toxicity. Lastly, one of the best practice topics for patients is to limit their sodium intake and increase their potassium intake. Heart patients, obviously, we always want to decrease sodium intake. Too much sodium can cause higher blood pressures and further problems with the heart. And increase the potassium will help to intake through food will help to prevent hypokalemia, which can lead to fatal arrhythmias. And my second article was my research article, and it was done on whether oral herbal agents are helpful in treating heart failure. It's already been shown that they do have two injectable herbs, which are the shenfu and huangi, injections that help with CHF, and those are herb-based. But this research article wanted to look into the oral forms of certain herbs to see if they help. The research was done on participants that were taking oral medication or oral pharmacologic agents, and then they had the different criteria of whether they were on a placebo, they didn't take anything else, or they took the oral herbs. Patients in the study had heart failure. They all had heart failure. They were all given the Minnesota Living with Heart Failure questionnaire, and that basically determines the quality of life. Better the questionnaire results show that you have a better quality of life. Huangi and Renchen were the two most commonly used herbs, and they are thought to be beneficial in strengthening the key. When compared to patients who took a placebo and patients who had no other interventions, patients that took the oral herbal therapies showed to have an improved quality of life. So they suggest that patients that take the standard pharmacological medications along with an oral herb tend to do better overall. And then this is a list of my references. And then lastly, my patient handout. So I started with the indications, which were heart failure and arrhythmias. I discussed the various actions of the medications, side effects that you're going to see, including digitoxicity. I went over different actions between medications, different herbs, and different foods. And then which foods, like the potassium, are going to help the medication to have less side effects from low potassium. Then I also went over administration. It can be given IV. It can be given a muscle injection or orally, and then how to determine dosing, and then when you need to notify a provider. So signs and symptoms of adverse effects or toxicity. If you feel you need to stop the medication, consistent change in the rate rhythm of the heart, weight gain or loss of more than 3 pounds in a day, and before starting any over-the-counter medications. So that's my presentation on cardiac glycosides. I hope it was informational, and thank you for listening.